Hospital on preparedness of the facility to tackle cases of the coronavirus. Women groups in the area have decided to support the hospital with sanitary material as part of their contributions to development of the second biggest medical center in the country. Ebrima Bah is on the hospital ground, not on medical admission, but on medical observation for the Good Morning Africa program. Well, thank you very much, Ebrima, and thank you for joining us. Very happy that you are, of course, on observation. How prepared is the Kanifing General Hospital in the wake of the COVID-19?
On this ground, which is the largest medical facility in the country, is definitely part of the show in the wake of COVID-19. So right at the gate, the Kanifing General Hospital, which was formerly called Serekunda General Hospital, has some measures in place which are very noticeable. Yeah, the hand washing is highly enforced, and some screenings, according to the WHO measures, are all implemented. That is, having some temperature check and some questions one has to answer before getting access to the ground is all enforced. And now this is not a treatment center. It is a hospital, and then that is prepared to be a holding center for any possible case of COVID-19 before their onward transmission or for transfer to the treatment center, which is the sanatorium in Banjul. So this place is definitely has a large catchment area, meaning that all the facilities and the preparedness is to be enforced on this hospital here.
All right. Now, what support is coming from the women in the area to the hospital?
We understand this morning women groups within the Kanifing municipality, the host of the hospital, are also bringing up some support initiative to the hospital. That is a part of their contribution to fight the COVID-19. The hospital being this large and, the catchment is large, so they would always say that the hospital needs the collaboration of the community. And now you have women groups who are living within the community here to, gather up some funds, and then we know they are bringing up sanitizers and then, detergents, things that are, definitely necessary for the Kanifing hospital to use. Even all corners or all Johnsons within the hospitals, in all wards, you have hand wash basin, and the ministry will always say that there are a lot already, but this is what we understand on this ground, that it can never be enough. So one of the officials we spoke to earlier on the ground said to us that there is no country that has enough material. So having donation coming out from the members of the community, it will be highly welcome. And the presentation of that, initiative will take place by 10 o'clock. That is in the next 1 hour.
All right. Now, have you tried to talk to any of the staffs in the Kanifing municipal, of course, Kanifing hospital rather, for official details about the COVID-19 or work at the hospital at the moment?
Yeah, we have a staff. Today we will be talking with the hospital administrator, who will give us some details, because knowing that COVID-19 is now discovered in the country, what does this mean to the traffic of the hospital in terms of admission of patients? Has there been any change? So there is where I will welcome Babukar Sen, who is the hospital administrator.
All right, thank you very much for having me. Good morning, viewers. My name is Babukar Sen. I am the administrator of Kanifing General Hospital. So with regards to your question, I just want to say that well before the Gambia recorded its first case of COVID-19, this hospital has been preparing itself, knowing fully well that we are strategically located and we serve in a huge catchment area of about 600,000 inhabitants. When we recorded the case, what we did was, as an institution, is to put in place some institutional arrangements. Key among them is to make sure that all our clinicians are trained on the case management and also on infection prevention and control to prepare them on this COVID-19, so that they know what this is all about, its mode of transmission, how they can protect the community and how they can protect themselves. So our doctors, our nurses, our lab technicians, and our support staff, even the athletes, the security, are well informed and well trained about COVID-19. Secondly, also, we have installed what we call hand washing stations. If you look at them, they are distributed everywhere in this hospital. And we have ensured that visitors, patients, and also staff wash their hands regularly and scrupulously. And now, before you enter our hospital, we make sure that you are screened. What we do is that we use the infrared thermometers to check your temperature. If your temperature is very high, we will also ask you some questions, like whether you have travel history or whether you have come in contact with somebody who recently traveled to certain hotspots around the world. We also ask you whether you have sore throat, dry cough, difficulty in breathing. Now, if you answer yes to all these questions, it's very simple. We'll just isolate you, give you a mask, give you hand sanitizer, and then we send you to an isolation unit. The same thing, a team will come and also give you some psychosocial support. Well, it's not just enough to just isolate somebody like that. You have to explain to the person what is going on. Otherwise, they will have this fear factor. So that is also another measure that we did.
Looking at the wards, we know there are patients admitted right now. So what measure is being in place to ensure the spacing, the social distance?
That is very, very important. Actually, what we have even done before talking about the admission wards is to scale down on our operations. Now we are just operating at an essential level, meaning that we're attending to emergencies and certain conditions that cannot wait for long. So what we have done is that we have canceled all the elective operations that are the planned operations. We have also made sure that we give patients coming to our clinics long appointments so that they don't have to be meeting here all the time and be overcrowded here. And if you look at all our clinics now, we make sure that at least there is 1 meter spacing between patients to make sure that they are not overcrowded. In the wards also is the same thing. So by and large, we have really scaled down on non-essential services and focus only on essential services. And this has allowed us to reduce or limit the number of patients that are coming into the hospital. And by so doing, we are now able to make sure that there is social distancing and there is space between patients.
It has also been insinuated that the number of patients is dropping down simply because there is stigma associated with coming to the hospital in the wake of coronavirus. Is that also substantial here?
Well, yes. The number of patients coming to our hospitals have reduced. It's not only this hospital, it's nationwide. But I don't want people to stigmatize COVID-19. It's a disease like any other disease, and it doesn't mean that anybody that has COVID-19. We have to be very careful about that. Well, this was a problem that we had with tuberculosis. This is a problem we have with HIV. So we don't want anybody to stigmatize COVID-19. Okay? And what is important is that if you have the signs and symptoms of COVID-19, which is fever, dry cough, sore throat, difficulty in breathing, call 1025. Okay, and once you call that, we will come and support you. And all the treatment that you need, all the support you need, we make sure is provided. But let people not stigmatize COVID-19. Okay, the reason why numbers are dropping, we are not sure. But we want to believe that there is this fear that if I come to the hospital, they will diagnose me with COVID-19. No. Okay, if you have an urgent case, if you have you are very, very sick, come to the hospital, and seek treatment. Our hospitals are open. We operate 24 hours, okay? But if you have those signs and symptoms of COVID-19, call 1025. So we don't want people to stay at home until it is too late. Then they rush to the hospital. Then it will be very difficult to help them. And let no one stigmatize COVID-19.
Yeah, we also know that this is not a treatment center. Yes. The treatment center is at Sanatorium, RVTH, near Banjul. How long do you have to hold cases here? Or in fact, how prepared is this center to hold cases? How many cases could you hold for a while and how long? Okay,
that's a very good question. I have said this thing earlier, that this particular institution, long before Gambia recorded its first case, and long before the WHO declared COVID-19 as a public health emergency of international concern, we started preparing. We started preparing a long time ago, and we did that by training our doctors, training our nurses, our lab, even our support staff, the orderlies, we trained them. We also make sure that we secured enough PPEs. Those are the personal protective equipment. We also make sure that the hand washing stations are everywhere, and we also made sure that anyone coming into our hospital is properly screened. So these are measures that we have put in place to make sure that we are well prepared. Now, your question about holding area. Yes, we are not a treatment center. The treatment center is in sanatorium. Okay. However, we have a facility where we can keep suspected cases. That is those who meet the case definition. I have mentioned that thing earlier, the fever, the dry cough, difficulty in breathing, and the sore throat. So what we do is that if you have all those classical signs and symptoms, we give you a mask to put on to prevent you spreading the virus further. We give you hand sanitizer to sanitize your hands. Then you will go with the nursing staff, you'll be isolated. It's a well-built, well-equipped and well-resourced facility within the hospital. Now you'll be there and we will call, there's a mobile team that comes and collect your sample. So they will collect your sample and send it to MRC. Currently it's only MRC that is doing these tests. So it takes about 24 to 48 hours for the results to be out. So if you are negative, we will further cancel you and ask you to go home and self-isolate for another 14 days. Okay, and we will also be monitoring you because in this hospital we also have our task force that is responsible for coordinating the preparedness and response to COVID-19. If it is positive, we will call the Ministry of Health, the EDC, they will come and collect that patient and take the person to the sanatorium.
Just lastly, we know there are women coming to give some donation support to the health center. What does this mean to the hospital, of course? What does this mean to the SK hospital?
Wonderful. That's a good question. It means a lot to us. Remember, I've been saying this thing, COVID-19 is bigger than any country. Yes, what is being given are sanitary materials, bleach, soap, detergents, Dettol, you name it. So they are bringing this thing to help us in our response, in our fight towards COVID-19. As you can see that the hand washing stations are there. In any bucket, we put bleach there, we put detergents. And it's very difficult for a hospital like this to sustain that because we don't know how soon COVID-19 is going. So what this thing means to us is a lot. Secondly, also, it also means that the fight against COVID-19 should not be left in the hands of the Ministry of Health. The community has a very important role to play in the fight against COVID-19. In fact, we are here to serve the community. So it requires the collaboration between the community, between our institutions, between the government, the private sector, and NGOs for us to fight together. All hands must be on deck to beat coronavirus in the Gambia. Thank you very much for having me.
That was Babukar Sen, administrator of Serekunda, or now Kanifing General Hospital, speaking to us to clear some of the areas that we needed a lot of clarifications. And Amadou.
All right. Thank you very much for your time. It was indeed a pleasure having you and, of course, having those clarifications done by the health official. Thanks for your time.
You're welcome,
Thank you very much. That's our very own Ebrima Press Bah, senior editor and correspondent, speaking to us live from the Kanifing General Hospital, formerly of Serekunda, as you have just mentioned. Well, press mu doon wax ak ñi nga xamante ne ñoom ñoo ŋànk hôpital boobu foofu ci Kanifing mu nekk l'hôpital bu mag te ñu bari ñu fay dem waaye jamono ji taxawaay bi ak li nga xamante ne mooy naka la ñu mën a diilee ak coronavirus bi dégg nañ leeral yuñ ci indi mu nekk lu am solo te kim doon waxal nee na daal li nga xamante ne mooy ñoom yàgg nañoo waajal seen bopp pour dékku li nga xamante ne mooy cases yi in case bu fekkee ne am na ki ko am ci hôpital bi waaye nag ñoom foofu duñ ko faj ak yooyu mu nekk lu am solo te jigéen ñu dekkee tamit ci gox bi ñu gis ne tamit ñu ngi ñëw booloo dem yóbbu ay ndimbal ci hôpital bi loolu yëpp mu nekk li nga xamante ne mooy initiative yu rafet.
waaw am na solo bu baax Amadou comme ni ko presse doon waxtaanee ak Mr Sène wax na yu am solo waaye li ma si gën a lifin mooy comme nit ñi dañ am rôle bu rëy pour play ko si this coronavirus. waaw mooy jéem a naka la ànd ak sarta yi. ba pare itam di ko jéem a déglante si seen biir because nit ñi suñ ko gëmul rek wala play wuñ si rôle buñ si war a